Thank you, and good afternoon. I'd like to thank the organizers for the invitation to be here. It's not often that the faith-based organizations get a place at the table here, so it's really quite a privilege to be here. And I want to thank especially Julio for his great collaboration and encouragement. I have no conflicts of interest to declare. And Luis, I think I need to start with a confession since I've stolen one of your slides. So please forgive me. But this is some data that was pulled together from a number of different sources by UNAIDS. And it shows the burden of healthcare that's borne by faith-based organizations in a number of the African countries. And you could see that many of them are 40% or higher, some much higher. And this is very consistent data with some that had been collected through a meta-analysis study that was done by WHO back in 2007, where they estimated that between 40 and 70% of all healthcare in sub-Saharan Africa was borne by faith-based organizations. And while Caritas and many church organizations have had excellent relations with UNAIDS and even with the old global program on AIDS, I think this kind of data really convinced UNAIDS that they needed to include faith-based organizations as key stakeholders in the discussion around achieving the 90-90-90. And for that reason, UNAIDS and Caritas co-organized a meeting in Rome in February of 2014, and you could see it was co-sponsored by a number of other organizations as well, to try to engage faith-based healthcare providers and social providers to become more involved in the treatment programming then. At that time, it was the Treatment 2015 initiative. To prepare for that, we actually did a study, a survey with those who were coming for the meeting, and then later followed up with more in-depth telephone and face-to-face interviews with them to try to drill down the data on this as well. And I chose a few of the programs to present here. The limitations in time wouldn't allow me to present more, but actually UNAIDS and Caritas are working on a co-publication to present much more detailed data that we collected in relation to this study. And the first one is the AIDS Relief Program, a PEPFAR-funded program. It was coordinated by Catholic Relief Services in the United States, but it was a consortium of both faith-based and other organizations. And over a 9-year period, working in 10 countries, CRS was able to channel some $740 million in PEPFAR support. All in all, they served about 713,000 clients. 395,000 were enrolled on ART. It was robust community-based treatment services, many of them through very small clinics and dispensaries and outreach programs beyond those as well. So they really went into the local communities and, in many cases, the more marginalized communities. And I think you'll agree when I show you the next slide that they had some excellent clinical outcomes. All in all, over the whole period, there was a 10.6% loss to follow-up. The patient mortality was 7.8%. Then the good news, the viral suppression was about 85.1%, and you could see this covered all of the countries and very, very similar data for those countries. Another program that I don't want to be accused of being prejudiced toward the Catholic Church, so CHAZ is the Christian Health Association of Zambia, mainly the Protestant church programs in Zambia. They're a long-time stakeholder in this area of HIV work, and you could see the large number of services that they help to facilitate through their programming. And I think this is also key and very distinct, as far as I'm concerned, of the faith-based organizations, that they don't only follow a biomedical model. They also are very much involved in the social issues, and some may not agree here, but I think important is also the kind of spiritual and pastoral care that they provide, because let's remember, in a number of these countries, more than 85% of the people are identifying with practice of faith. These are some of the rates that Chaz has shown, both the numbers of people being served and then the cure rates, especially around TB and other problems. Another program is the DREAM project. This is sponsored by the Comunità Sant'Egidio, an Italian NGO. And they started out in Mozambique. It was started on the same principle as the Partners for Health program, where they felt very strongly that people in low-income countries should not be subjected to second-class treatment. And so they were able to manage to get the funding to give first-class treatment at a time when that was very, very rare in low-income countries. You can see that they've expanded. They're working now in about 9 countries and have some very impressive statistics in terms of the kinds of services and the number of people served. The challenges that were reported are, it's difficult to maintain high adherence rates to ARVs, but overall I think you'll agree that the statistics show that they've done it fairly well. They manage the managing of implications of reduced financial support. This came through in almost every single survey that we received, and also then most especially in the personal interviews that we gave with them. They're being asked to do more, and this was the theme that Luis heard in Rome constantly. You're asking us to do more, but we've lost half the staff. How are we going to do that? You need to help us find the support to do that, even though they understood very clearly that UNAIDS is not a funding organization. And then producing the quality strategic information. I think this shows some excellent data, and most of that data was collected by outside sources, objective sources, but it is hard to produce that kind of data. And then the kind of keeping up with the holistic, comprehensive care. I'll close with this quote from Michel Sidibe. He actually spoke with Pope Benedict during a papal audience and talked about the kind of programming that we're trying to accomplish through the global plan to eliminate new infections among children, and also to keep mothers healthy, as well as the early prototypes that eventually led to 90-90-90. But he pointed out the kind of social justice commitment in faith-based organizations, the perspective of looking at individual dignity of people and having a patient-centered approach. Thank you very much.